Hello, welcome to my channel. My name is Pauline RN. The title of my video today is Sensory Stimulation Part 2. Questions and answers are an Nclex examination. Please hit the thumbs up button. Please subscribe with that black button. Please share this video with your friends and families and classmates. Let's get started. My first question, what is myopia? Correct answer, nearsightedness. Next question, we have 3 types of sensory deprivation. Name them. The correct answer for 3 types of sensory deprivation. First one is hearing loss. Second is elimination changes due to new or strange environment. Next, we have restrictive environment. Produces boredom, produces restlessness, produces increased anxiety, produces panic, increased need for physical stimulation in a restrictive environment. These are patients who are our total care patients. These are examples of patients who are in the ICU, and these are our types of sensory deprivation. My next question, name perceptual effects of sensory deprivation. The correct answer, perceptual effects of sensory deprivation causes, correct answer, changes in visual, motor coordination, reduced color perception is your correct answer. Loss of tactile accuracy reduces ability to perceive shape, size, and judgment. These are perceptual effects of sensory deprivation. Next question, what are our sensory overload? Correct answer is sensory overload when a person receives multiple sensory stimuli and cannot disregard or selectively ignore some stimuli. Patients, for example, on monitored floors, there are a lot of machines going off. Multiple sensory stimuli. Patients who are in pain, patients who are on bed rest, critical ill patients are sensory overload. Next question, clients who are at risk for sensory deprivation. Who are these? The correct answer, patients who are on bed rest, depressed patients, patients with communicable diseases. These clients with nervous system diseases is the correct answer. Patients with communicable diseases, they are in a private room, risk for sensory deprivation. Depressed patients, they like being alone, some of them. Patients on bed rest. Next question, how does the nurse assess sensory and perceptual function? The correct answer, The nurse assesses the nursing history of the patient. Next, number 2, the nurse assesses the physical examination of the patient to identify sensory perceptual functions. Nurse assesses sensory perceptual functions by the nursing history and by physical examinations. This is how we assess sensory perceptual functions. We go to the nursing history. We can see what was going on with this patient at home before they came into the hospital. My next question: how does the nurse identify the risk of clients with sensory perceptual function? How does a nurse identify clients at risk for sensory perceptual function? The correct answer is the nurse identified by assessing client support system is the answer. The nurse identify clients at risk for sensory and perceptual function by assessing the patient's mental status is the correct answer. My next question is, what will be the nurse's strategies to prevent injuries? Clients with sensory alteration. The correct answer is speak calmly with patient. Move slowly with patients. Communicate with confidence. Explore with patient what stimuli are distressing to the patient. Example, incoming phone calls. Maybe multiple visitors at the same time. Administer pain medications to these patients. Administer anti-anxiety medications to these patients. When you're gonna provide care for these patients, we will cluster our activities. We do not want to keep going in and out in these patients' rooms. If you're gonna give a bed bath, you can go in and do your bed bath and do your vital signs and do your medication administration all with one visitation. Cluster your activities. Do not keep going in and out the patient's room for patients with sensory and perceptual alternations. Explore stimuli that are distressing to patients. Next question: how would the nurse manage deficiencies with patients of sensory deficiency? The correct answer: patients with sensory deficiencies, the nurse would give them hearing aids, give them glasses, give them dentures, offer mouth cares, swabs, use thermometers to identify their bathing waters. Make sure the bathing waters are not too hot. Avoid clutters in patients' rooms. Keep rooms clear of clutters. Keep rooms tidy. Don't throw everything all around in patient's room. Avoid clutters. These patients, they have sensory deficiencies. Avoid environmental stimuli. Decrease your phones. Turn the TVs on or off or low. Use family pictures in the patient's rooms. If they see pictures of their families, they will think they are home. They need a familiar environment. Decrease falls of these patients. Remove clutters. Decrease noise levels. Turn those televisions and those phones down. Decrease lightnings. Do not have too much unnecessary lighting in these patients' rooms. On these patients, you keep them close to the nursing stations. Do frequent rounds on these patients. These patients are at risk for falls. Keep them close to the nursing station. If these patients are in bed, have your bed alarm on these patients. If they are sitting in the chair, have your chair alarm. A chair alarm is actually use communication boards for patients who are unable to hear. Write on communication boards for these patients. Some of them can write and they can respond. For these patients with sensory alterations, deficiencies, we will also use a language interpreter if they are not English speaking. We need an interpreter who is employed by the hospitals or nursing homes for medical terminology. Some patients may need sign languages. Some hospitals have people who are employed to assist patients with sign language. Please hit the thumbs up button. Please subscribe with that black button. Please share this video with your friends, families, and other classmates. Thank you. Have a blessed day.